Enter the room.
Hello,
Hello.
I'm one of the FY2 doctors in the GP practice. Can you confirm your full name and age for me, please?
Yeah, my name is Mrs. Amanda Brown and I am 35 years old.
Okay, Amanda, so what do you want me to call you?
You can call me Mrs. Amanda.
Okay, so Mrs. Amanda, what brought you to the hospital today?
Yeah, doctor, actually I have got pain in my right foot.
Okay, so can you localize with your finger where do you have the pain?
Yeah, doctor, is especially on my right foot and it's between my toes.
Okay, so since when are you having this pain?
Doctor, likely for 2 months.
For the last 2 months. Okay, so is the pain on and off or is it continuous?
Yeah, it is kind of, it comes and goes. Yeah, it's not continuous.
Okay, so does the pain also radiate to anywhere else?
No, doctor, no, just between my toes.
Okay, so are there any other symptoms you are experiencing with it?
Like what, doctor?
Like, did you suffer from any fever or any muscle pain also?
No.
So what about your left foot? Is that all right?
Yeah, left foot is all right. Yes, doctor.
Okay, so do you remember any history of trauma to your foot?
No, doctor.
Okay, so did the pain just started suddenly or was that gradual onset?
It was kind of gradual.
Okay, so can you remember what exactly was happening with you or what were you doing when the pain started?
I'm not sure, doctor. Started gradually, and I feel like it's getting worse, and it's affecting my daily activities now, doctor.
Oh, that's so sad to hear about this. Okay, so, um, do you also have any other medical conditions
No, doctor.
like diabetes, hypertension, or anything?
No, doctor. Nothing significant.
So, any history in your family like this?
No, doctor.
Any history of like arthritis or joint problems or bone problems?
No, doctor.
Okay, so any other joint or muscle of your body have been affected by this?
No.
Okay, all right. So can you tell me about your occupation? What does it involve a lot of sitting?
Yeah, doctor. Actually, it was a lot of standing.
Okay, it involves a standing. All right. So talking about your other habits, can you tell me about your eating habits? About what does your diet consist of mostly?
Yeah, doctor. Try to eat healthy, balanced diet.
Okay, and what about smoking or drinking?
No, I don't smoke and I drink occasionally.
You drink occasionally. Okay, so s- Mrs. Amanda, I just like that some people just like to drink for like their fun or pleasure time, and but some people drink when they are struggling through something. So, is there anything you are struggling with, or just you drink occasionally?
Yeah, occasionally, doctor, just in parties, just for fun sake.
Okay, so are you aware of any limit set by the medical professionals that how much
Mm,
units of alcohol you should take?
No, I'm not really sure, doctor, but I don't drink much. I just occasionally drink on weekends when I'm in a gathering or a party.
Can you tell me how much units do you take?
Yeah, I'm not sure about the units, doctor, but just a few bottles of wine every weekend.
Okay, so Mrs. Amanda, I have to do some examination of your foot, okay?
Mm-hmm. Yes, doctor.
Okay. So are there any examination findings? No?
Please
Uh,
mention the examination you'd like to do.
I did the examination of her foot and I also want to do the X-ray of her foot to see if there's any problem with any bone or anything. Okay, so Mrs. Amanta, I have noticed that there is some tenderness between your third and fourth toes. So, according to your history and your examination, I just thinking that this may be due to there might be raised uric acid levels in your body that are leading to accumulation in accumulation in the toes and then leading up to swelling. Do you
Okay.
understand that?
No, doctor. So, what is this condition? I never heard about it.
So this condition is called hyperuricemia and it leads
Mm-hmm.
to gout. Gout is the condition where we have swollen up toes and then they also hurt very much. So the leading cause of this is mostly
2 minutes remaining.
alcohol
Mm-hmm.
consumption, which is the
Okay.
root cause of it. So I will also run some other tests for you, like I will do your blood uric acid levels, the complete blood profile, clotting factors, your liver function test to see if your liver is functioning properly, and
Mm-hmm.
then we'll be very sure about what's the main issue with you. But as far as I have seen that you might be suffering from hyperuricemia because of the alcohol intake. That
Okay,
might
I
be the
see.
reason. Okay.
Mm-hmm. Okay,
So,
doctor. So, what you're going to do for me now?
so right now I will prescribe you some painkillers to relieve the pain. So I
Mm-hmm.
will give you paracetamol and you can also use cold compresses to
Mm-hmm.
lower down your pain for the soothing feeling.
Mm-hmm.
So is there any other concern about you want me to address?
Yeah, doctor. Actually, I tried taking some painkillers, but paracetamol, but did not work. So, what should I take now?
Okay, so if paracetamol did not work for you, then we can go for medicines like colchicine. But that will be done after we just completely investigate investigate the problem, like when the blood levels come back.
Okay, doctor.
Okay, according to that, we will go for other medicines and long-term prescription.
Hmm.
Right now, I will refer you to the rheumatology clinic, and then on a routine referral, and then they will just see what to do next.
Move on to next station.
All right. Thank you very much, Dr. Sana. Good job. Good job. Thank you, Dr. Salman, as well. All right. So let's have a discussion. All right, Dr. Sana, so one thing that I'd like to advise you is you were asking about how many units you take. Units is,
Hmm.
measurement term that you know. It's not
Okay.
necessary. The
Even being a doctor, I don't know. So how can patient know?
I mean, yeah.
Okay.
So that's again jargon, like that's how you would quantify. So you would actually want to ask her how many glasses in like colloquial terms in which how she has, right? So that
Okay.
you're not causing confusion to the patient. I mean, you are meaning something, but they don't understand what you're meaning. So you
So
have to use,
I'll just ask them about the glasses and bottles and just think myself that how many units she is consuming.
yeah, but yeah, that's
Okay.
yeah, you have to do the conversion in your mind. But yes, what were the things that made you think that this was gout? What were the symptoms that made you think? Or what is it that made you think it was gout?
Because I could not think of anything else. Firstly, I thought that she's with pain in foot. There might be some fracture, but I
Uh,
didn't get the X-ray.
that's true. Okay, you didn't get any trauma history either.
Yeah, I
Yeah,
also asked about the trauma history too.
yeah. But what are the other differentials that anybody can tell me, that might affect foot or small
Yeah.
joints? Can we have the rest of you guys chime in? So I was saying, are specifically numbness, that's a good point to differentiate. Yes, other than pain, you have numbness, right? Is it the nerve involved? Is it, you need to understand that. That's a good point. How numbness, Dr. Anu was asking. All right, so in this case, when Norton's neuroma happens, it actually is the thickening of the nerve, the between the two metatarsals. All right, so that is what is causing the pain, and that's what even comes as numbness. Sometimes you also might feel numbness, right? And this is something that is gradual and it happens over time. You have to look for some risk factors, like do you stand a lot, or tight fitted shoes. If you're wearing all that, then there are risk factors that you might need to exclude, right? So think about the region that is getting hurt. You understood that it was asymmetric. That was good. You understood that there was no other joint involved. It's just one single joint. So then that kind of made you think that it was this one, what was it, gout. But after,
Yeah.
other than that, you never really got anything else,
Yes.
right? You were trying to force it to be gout by emphasizing on the alcohol history. There was no positive history there, so you're looking for some positive history where there is no history. She's like, occasionally I drink, sometimes I go for parties and drink. And she's not trying to give you a positive history there, but then you try to you're asking multiple questions on something that you're not getting positive history on, right? You're trying to force it to be something. But if you're getting negative history, just let it go. If you don't know the answer, the best thing is to say that at this point it's difficult for me to say. It could be a range of things. It could be due to some condition where your blood uric acid could be high, and that could cause some stone formation. But we have to do further tests to figure that out. And I'd like to call in my seniors, just so that we can take a look. Because otherwise, at this point, you don't know, and you don't know, and you're forcing it to be something else. And that's a very dangerous territory to be on, because
Okay.
there's no positive findings. The other positive findings that you would have gotten would be any medication history. So if she is on any diuretics, she
Yes.
have, hyperuricemia, or if she's taking any of the TB medications, there could be another like pyrazinamide or ethambutol. They could also cause hyperuricemia. So there was no medication history. Otherwise, high purine diet, those are also something that can cause gout. She did not have any of those, right? But you were looking and you were making it feel that, it had to be alcohol. Like, just tell me the units. So, that was, so if you feel that there is no positive history, just move on. And then you can actually mention that I need to do further tests before I can actually make a diagnosis. But at this point, since it's pain, I'm going to be giving you painkillers. And what is the thing that you give for pain? There is price. There's a price protocol. Do you guys know what price protocol is? P for protection, R for rest, I for ice, C for compression, E for elevation. So, you can tell them to actually do all this. Tell them to elevate the foot. That might actually cause some relief. Put some ice pack,
The symptomatic.
symptomatic, and you're giving them medications like paracetamol or maybe ibuprofen, a little more stronger. You can ask them, did you take anything for this for the pain, right? Did that give you relief? Do you want to take something more, right? Yeah, let's quickly go through the performance Dr. Anum has marked. All right, so data gathering, you actually asked a lot of good questions. That was the best thing. You went into Socrates, you understood there was just one joint involved, no trauma history, lifestyle, and all. You understood that there was no risk factors there, but you understood that it was kind of causing them harm. It was kind of interfering with the daily life. One thing I'd like to tell you about examination is you can't just say, are there examination findings? You have to ask for the examination specifically. If you don't do that, then you will not get any findings. So if you say general physical examination, vitals including heart rate, BP, respiratory rate, saturation, and temperature, then only will he actually give it to you. He won't give you anything, until you actually tell them what examination you want to do. This is basically putting yourself in that situation where you are going to be in, as you do consultation in NHS. And so if you want to do the examination, you will actually have to do it on the patient, right? You can't just expect the examination to come to you. So until and unless you verbalize what you want to do, nobody's going to give you findings. All right. So always try to verbalize the examination that you'd like to do over here in this case. So if you want to do the foot examination, do that. I want to take a look at your foot. Say that I'd like to do some foot examination, right? Specifically. So, right. So this was a case of Morton's neuroma, as some of you might have guessed. And the thing over here is that it's gradual. It takes a while to. It's basically thickening of the nerve between the third and fourth metatarsal. So in gout, it's usually the first metatarsal under the big toe, ball of the big toe. Over here, it's third and fourth metatarsal in that side. So now what you do is, if you actually squeeze the leg, you can actually feel a mass. So I think there was a positive finding of, I think in the simulator information, there might have been a positive finding where they say that I can feel a mass. Does she say that?
Between the metatarsals.
So you feel, so there is one line in the simulator information where they say that I can feel a lump under my foot and sometimes there is tingling and numbness. So those are positive, by the way. So in this case, you'll actually do feel a mass because it's actually the technique of the well. You will be able to do that. In fact, there is this test called the Muddler's sign. So what you do is you squeeze the foot in that area and you can elicit the pain. And you can feel the mass also. If you just roll the tarsals, transverse, you get the transverse arch, and then you just roll the tarsals, you'll nicely see the mass in this case. All right. And the simulator has also seen the mass. All right. I just wanted to point that out to you guys. And there is numbness and tingling in this particular case. I've incorporated that. So, Dr. Sana saying the hearing.
Just one question, Dr. Dan. If the simulator can tell us that I can feel a mass, even if we don't ask directly, will he tell us?
I mean, it depends on the, simulator, what the concern they come with. They come with pain. I mean, it's better to probe and ask, like, can you tell me what happened over there? Do you feel, actually, feeling a mass is actually a good question to ask. Is there anything over there that you feel that is growing? Because tumor is something that you should keep in mind as well, right? Other than the other differentials.
Okay, very right. Yeah.
So that's a good question to actually ask. Right. Yeah, well, let's look at the other points. Acknowledge and validate the patient's concerns. So, every time she said that I was in a lot of pain, you said things like, oh, that's sad. Say something more compassionate. I'm so sorry to hear that. I can totally understand. This must be very painful. Right. Just validate that, like, yeah, this must be really hard for you. I can only understand. Right. So next is understand a little bit about her, footwear habits. Like, does she wear any tight footwear? Because those are all risk factors, right? And you did ask about, what does your job involve, running? That is, I mean, long hours of sitting or standing. But that is also something that you can also ask by saying that, do you run a lot? Is there, do you take long walks or something like that? Right? Like, do you actually walk around?
Right.
That's all looking for risk factors, like what this could be, right? Overuse. So management, you did give NSAIDs, that is good. So this is also called metatarsalgia or Morton's neuroma. So Morton's neuroma, also often referred to as metatarsalgia, is a condition where the tissue around the nerve in your foot becomes thicker than normal. The thickening happens because the nerve gets irritated or damaged over time. With your running, possibly ill-fitted shoes, repeated pressure may have irritated the nerve, causing pain in the ball of your foot and sometimes a tingling or a burning sensation, right? And you could have given some conservative management, and conservative management actually works for anything that has pain, especially on the foot, right? So you can use the price protocol, wear comfortable shoes, because the pain is on the foot. So, even in gout also, you'll be saying those conservative things, right? Suggest soft soles or metatarsal pads. Otherwise, if that doesn't work, you can always say that, we will try this out. And then if that doesn't work, we can try something more aggressive. Right. So other management that you can give is corticosteroid injection if the pain is still not, getting better. And then the surgery is neurectomy. That if no other treatment, conservative treatment is working, then you would actually offer that, And you can also say that we will try offering a couple of things. We'll try with medications. We can try with some lifestyle changes where you can wear comfortable shoes and, avoid, standing or running for longer periods of time, take adequate rest, right? And provide safety netting if the symptoms seem to get worse. If you're unable to walk, please make sure to avail medical help. Give leaflets and pamphlets to get a better idea of what the condition is, like from a reliable source, and offer follow-up. So right. So I think I would have reduced marks over here because you kept asking units. That is kind of jargon. Right? Yeah, and use some sympathetic terms when you're actually understanding that they are in pain, right? And signpost when you're asking about difficult, questions, especially, when you're trying to ask about the alcohol history and all that. Signpost, I'd like to understand a little bit about your, lifestyle. So, may I ask if you drink, or this could help me in my consultation today. So that would be like a very sympathetic approach and, warning them that there's a difficult conversation coming up. So thank you, Dr. Anum. That was actually very detailed. Good job on the marking. Let's look at the information over here. So I think Socrates questions were very nicely asked by you. And overweight is also something that you can ask, like, you want to check for BMI. So that is also something that you can offer for management. But you can say that you can reduce weight. So Morton's neuroma, also often referred to as metatarsalgia, is a condition where the tissue around the nerve in your foot becomes thicker than normal. The thickening happens because the nerve gets irritated or damaged over time. With your running, possibly ill-fitted shoes, repeated pressure may have irritated the nerve, causing pain in the ball of your foot and sometimes a tingling or a burning sensation.
So much.
Right. So other management that you can give is corticosteroid injection if the pain is still not, getting better. And then the surgery is neurectomy. That if no other treatment, conservative treatment is working, then you would actually offer that, And you can also say that we will try offering a couple of things. We'll try with medications. We can try with some lifestyle changes where you can wear comfortable shoes and, avoid, standing or running for longer periods of time, take adequate rest in between. Yes, Dr. Sana.
So at this stage, we will not refer her to any orthopedics before the conservative management.
At this point, it's not that severe of a issue to be, referring this patient for anything, But if you have surgery, then you will be referring this patient. So, but then before that, you will be trying out different things because you want to see if they can be managed, right, in the GP
Okay.
itself. Because
So
if
we
it's
will just tell her about this conservative management, and then we will tell her if the condition gets worse and she can come back and the treatments fail, we can then refer her to the surgeon for neurectomy.
Yes, absolutely. Orthopedics would be great there. So one thing is there that that's what the GP is for. So at a community level, GP is your doctor. So if you have any issues, you go to the GP, right? So that's why you have to arrange a follow-up because I've given you a treatment plan. I want to see how that works, right? So you want to try out that plan and you want to come back and see me in the next 2 weeks. And then if it works, then well and good, continue doing that. Right. If it doesn't work, I'll try something, something more aggressive. I may give you the corticosteroid injection and, I may give you some stronger painkillers. I may go up to the ibuprofen or diclofenac, right? Or else, if that also doesn't work, then I'm going to probably, put a referral to the orthopedician, and then, they will take a look, and, they can suggest on what to further do. Because ultimately, if whatever you manage is helping them and they can carry out their daily activities of daily living, and they can do that seamlessly, that's good. Then you have actually, achieved what you want to. But then, unfortunately, if with your management they are still finding it difficult to carry out the activities of daily living, then you have to do something more to help, right? And if you are unable to do something more to help, that's when you start referring, because this is not an emergency condition, right? If it's a critical emergency condition, that's when you definitely have to refer, isn't it? If it's a like a parathyroid thing that you cannot give the management because that's a specialized treatment, you have to give specialized medications for that a GP cannot refer, only a specialist can. In those cases, you will be referring, because what you do is you identify that, oh gosh, this guy has something like a parathyroid disease or like an Addison's disease. I will be referring them to the specialist so that they can give the specialized treatment, because they need to be under monitoring, they need to be given special drugs, they need to have to undergo multiple blood tests to make sure that the levels are normalized, right? Even the endocrinologist, even with your thyroid, you actually go to the endocrinologist only, right? Because there is a huge issue if you maintain your thyroid levels. You have to keep continuously doing your thyroid levels, right? So that it
Yeah, right.
doesn't hyper or hypo. So think about which all are the specialist diagnoses and which all are the ones you can actually manage in the GP. So these are the ones that you can manage in the GP, right? Even gout is also something you can manage in the GP. If NSAIDs don't work, then you can next time when you come for follow up, and if it still doesn't work, then you can give colchicine, right? And you can go higher up the pain ladder. And then you can also give something to reduce, like a chronic medication like febuxostat or maybe allopurinol. All right. Any doubts, any questions? Anybody has anything to say about, Morton's neuroma? This is something that has been recently coming a lot, and it's a relatively easy case. So whenever you think about foot, apart from gout, also think about Morton's neuroma. I mean, one thing you can definitely ask is about the lump as well as the pain and tingling sensation.